Hi everybody, it's Susie and I'm doing a continuation of my video diary, post-op spinal fusion, lumbar fusion at L5-S1. And today is it's Monday, November 21st, and I had my surgery September 16th of 2010, so that makes me, I'm a year and 2 months post-op. And I just pulled up at work. I'm sitting out in the parking lot, but I wanted to update. I wanted to give you guys an update. I'm really grateful to be sitting here, and it's been quite a process. And for anybody that saw my video from Friday, crossing the bridge on the way home, that was just a purely selfish video because it's just pretty symbolic of me. Of this drive, this commute that I'm going through right now. It's a really long commute, and I've got about an hour to work and an hour and 15 on the way home, and I'm just willing to do whatever it takes right now to get back on my feet. So I want to be able to look back someday and see that and remember, I want to be able to remember this drive, and I'll be able to work from home here in the next couple of months, so it's just an investment right now to put this commute in. So anyway, I also want to just thank everybody that has subscribed, and I want to thank everybody that's written in. Initially when I did this video diary, when I had the idea from it, I wanted to be able to answer questions for people that are going through this, and so that people would know that they're not the only ones going through this. And because I had seen a video diary that somebody else did, and it really helped me to know that there was somebody else out there and I wasn't the only one, and yada yada. So I did this because I wanted to help other people, and so many people have written in, and anyway, the point of the story is that it has just helped me tremendously. So I just wanted to thank everybody that's written in. I mean, I can't even tell you how much this has helped me. So thank you. And let's see, what else? It's just been a process. I've gone through, terrible fear and anger and, denial and depression, and oh my God, what an emotional roller coaster this whole thing has been like. But I can walk around. I have my life back, guys, and that is the most important thing I can tell you about this whole video diary series. I'm not here to tell you that I don't have pain, but I have quality of life. And that was the whole question for me in the beginning when I got hurt, is will I ever have my life back? And after surgery, I was mad because, I didn't want to have any pain. I thought the pain would be gone. Now see, it's changed for me now. I have a different outlook on it. Now my outlook is, how can I adapt, and well, I take that back. I didn't think the pain would be totally gone, but I still didn't realize I would have it to the extent that I have it. It's still pretty significant. And what I mean by that is it's significant enough that I still have to go to pain management, which at first really pissed me off. I'll be honest with you. I wanted to just, excuse me, my mouth is dry. I wanted to be able to get off the narcotic pain medication after surgery and be done with it. And that's not how it's turned out. I had that bad episode of sciatica after physical therapy. And, here I am back with pain management. So now my mindset has changed to say, well, listen, in order to work and in order to pay my bills and support my son as a single mother, I have to have pain management in order to function. And that's just the way it is. So I have to accept it and move on. And if I do that, you know what? I have quality. Speaking of which, that brings us to where I'm at today. Thank God my attorney finally has gotten me to this the one good, well, my surgeon was a good doctor in work comp. He was the other good doctor I've had. Now, this pain management doctor has my back. And she lets me ask questions. She lets me participate. She doesn't get offended if, because I'm a nurse and I have half of a brain when it comes to medication. She doesn't take me as challenging her. You see what I mean? Like some of these other men, didn't want me to ask questions. They want to be the boss. They want to tell me how it's going to be. And if I ask questions, they said I was arguing with them. I'm not arguing. I just didn't understand. You see what I mean? So anyway, I have a good doctor, and I'm wearing now a Butran patch. I'll show you what that looks like. This is what it looks like. Butran patch right here. That's it. I wear a Butran patch. It works wonderfully. Comes in several different doses, and she's tapered that up. I do not feel groggy or druggy with that at all. It's a Schedule 3. So it can be called into the pharmacy, which is nice. And then for in-between doses, which I don't even really need during the day, I'll take it sometimes at night, I use Nucynta. Nucynta. And the Nucynta, this doctor told me that even for people that have had issues with addiction and alcohol, Nucynta, for whatever reason, is a pain medication that's not being abused. So I feel comfortable because that was my big thing. I didn't want to be on narcotics, because I feel like if this back problem is going to be a long-term problem, I don't want to be on something long-term that has the potential, to be addictive. And that's the bottom line. And I think we should all be aware of that, really. I mean, granted, we need pain medication, but we can't be stupid about it. There's too many people dying out there. And this is me interjecting my opinion, but that's what this is all about, right? This is my video and it's my opinion. But, we just need to be mindful of it. Because there's a lot of depression that goes along with the back problems too, as we all know. And that's a really dangerous combination, pain and depression. Anyway, that's my soapbox, and I'll get off of it now. But the Nucynta, it does not make me feel groggy or druggy. Sometimes if I'm tired already, yes, I'll get a little tired from it. And that's why during the day at work, I don't normally ever have to take it. I'll just take it sometimes in the evening, and after I've driven home, and I've been sitting all day, I'll take it at night when I go to bed, or I'll take it on the weekends and stuff like that. So, I do still get burning. Now, where's my pain? I do still get burning in my sacral area, like at my tailbone. And I still have that one specific spot on the left side of my, to the left of my tailbone, where I'll get, it's like a hot, sharp pain. And you know what, though? The pain that was so terrible in my right hip, going down the right side of my leg and in my calf, that pain is completely under control. I'd say my pain is 95% controlled. The other thing she added was Cymbalta. That she says she uses that for pain management. It can be used for nerve pain. And in pain management in general, it is an antidepressant, so it makes my mood pretty chipper as well as an added bonus. So Butran patch, Nucynta for breakthrough pain. I still take Lyrica twice a day. I would like to, I'm just kind of at the point where if it's broke, don't fix it. But then there's the other part of me still that would kind of like to not take all this stuff. But it's working, so I think I'm just going to leave it alone, I do kind of think she's working me up. Maybe, we have talked a little bit about a spinal cord stimulator. You know, the thought of that makes me really nervous, simply for the fact of the risk of infection. That makes me really nervous. But that might be coming up in the future, a discussion about that. Did I already say? No. She did repeat my EMG. Now, my EMG was done at the surgeon's office by his partner, who said it was normal. Now, this pain doctor said she didn't see how it could be normal, and that every single EMG she's ever seen from this physician, he has read it as normal, which she saw as very strange. And she always had them repeated from that doctor, and usually they were not normal. And sure enough, she had mine repeated by a different practitioner, and mine was abnormal. She said the person that did mine, the physician that did mine, said it was abnormal at the level of L4, L5, which is one level above my fusion. And I have heard, or it's been told to me, that you have problems the level above and the level below your fusion. So, but this practitioner, the physician that did my test, said that in my case, it didn't look like this was a post-operative problem. It looked like it was a degenerative problem for me, like a more long-term problem. I don't really know. He said my doctor would explain that to me when I see her. So I see her on the 28th, and I'll update you guys again. But that's why I said I think they're kind of working me up for a spinal cord stimulator. Because I think this pain that I'm having is going to be a long-term problem. You see why I kind of have to be in acceptance of it, and just be thankful that the patch is working, and, kind of know I'm probably going to have to take some kind of medication and just live with it. But it's under control right now, and I'm able to work. I'm able to have a good time with my son, and that's what it's all about. That's all I need to be happy. So, that's it right now, guys. Any questions? Anything? What are your thoughts? Anybody have a spinal cord stimulator, or know of someone that does, or anything? Any thoughts, questions? Please let me know. And take care. I hope everybody's doing well. Hope this has helped. And we'll be in touch. Till next time. Bye.